It's now 5 after the hour. Hi, welcome everybody to the inaugural presentation of SCA Conversations. I'm Jonathan Gartner. I'm a board member of Sustainable Change Alliance, also known as SCA. On behalf of myself, Peter Brill, the chair of SCA, and the entire SCA board, we welcome you. For those of you that don't know the organization, SCA is an impact-oriented, member-based, not-for-profit educational group. We're focused on impact investing, which we define as bringing financial and other resources to bear on so-called double and triple bottom line organizations that are trying to address big social, environmental, or health issues. And they're trying to do that in a sustainable manner. Some of those organizations are for-profit, some of those organizations are not-for-profit, and some come from the independent sector. And today we have an absolutely perfect speaker to share how the Santa Barbara philanthropic community is rising to the challenges posed by the coronavirus. Before I introduce the speaker, I want to thank the members of SCA. For those of you that want to learn more, you can check us out at sustainablechangealliance.org, where you can learn more about SCA and about community-based impact investing and consider joining us in this effort. I'd also like to thank our generous sponsors, maps.com, Argyle Capital Partners, UBS, Nixon Peabody, JP Morgan Chase, and Brashears. Without their support, we couldn't bring any of this programming to you. I'm sure everyone's become an expert in Zoom protocol in the last couple of weeks, but we're going to have you all on mute while our speaker makes remarks. We'll have questions later on in the session, and just for ease of taking those questions, I'd ask you to use the chat button, which, as you probably all know, is at the bottom of your Zoom screen. Jackie needs to finish up by 1:45, so I beg your indulgence if we don't get to every question, but the event is being recorded, so you can always listen again if you wish. So our kickoff speaker, as I hope everyone knows today, is Jackie Carrera. Jackie is the interim CEO of the Santa Barbara Foundation, which was founded in 1928 to enrich the lives of the people of Santa Barbara. The foundation's mission is to mobilize collective wisdom and philanthropic capital to build empathetic, inclusive, and resilient communities. Pretty ambitious goals, and all the more important today. Jackie has the particular challenge of leading the Santa Barbara Foundation at this tremulous time, but speaking personally, she brings exactly the right kind of leadership and people skills to the table to do so. In addition to serving as the interim CEO, she's keeping her old job, which is the Chief Business and Revenue Officer. And before that, she was President and CEO of Parks and People Foundation in Maryland for a good 2 decades. I'm also very proud to say that Jackie is a key board member of the Sustainable Change Alliance and a good friend. So Jackie, thank you for joining us. It's a strange and scary time in Santa Barbara. Why don't you take some time to share how the foundation is leading the local COVID-19 joint response effort? Over to you.
Thank you. Am I coming through okay?
Loud and clear.
Okay. Well, first of all, thank you, Jonathan, for that introduction. I am thrilled to be a part of the Sustainable Change Alliance, having been working with you all for the last 1.5 years now. It's really inspiring to be a part of a group of people who just really want to make their community a better place. And so I've been watching that organizationally evolve over the last 1.5 years, and every day, every meeting we have, I just get more excited to be a part of it. So thank you, and to all the board members who are on the call as well. You know, this is an interesting time. Here we are as a community foundation. Community foundations are unique to begin with, because we are a combination of being a foundation, giving money away, and also a nonprofit where we are, soliciting donations and contributions from the community all the time. So we kind of act like both at the same time, and it's an interesting model. But I think never has that model been more important than in times like this, where we're at the intersection between community and philanthropy. And so when you were reading our mission, it has never meant more, I know, to our staff than it does now to be mobilizing wisdom and philanthropic capital, because we need it, more than ever at the moment. I want to, before I launch into what's going on with the joint response efforts, I wanted to take a moment just to say that I do hope that this is more of a conversation. I don't want you to be listening to me for 45 minutes. I actually, I and my colleagues who are on this call want to hear more about what you have to say as well, what your concerns are, or what your thoughts are. And so I do hope to leave enough time for questions and for more of a dialogue and conversation. So that's the way I'm going to approach this webinar. So when this all started to unfold earlier, late February, beginning of March, we didn't really know what was coming. But what I can say to you is that from the perspective of a business leader, we had to put our mask on first. And I remember just this funny conversation in our staff meeting saying, we need a business continuity plan, which we had bits and pieces of, but we needed to pull out what those procedures were, and things hadn't really gotten crystallized yet as to how this was going to unfold. And so the need for a business continuity plan was all theoretical at that time. And so we really worked hard over the next, I'd say, 5 days to say, what if, run all these different scenarios, what if we weren't able to come to the office? What if we had to work remotely? What if? And we started to put that document in place. And then we shared that with our community. And I think it was at that moment for me that I realized that we as a foundation are going to be looked at to provide information, to provide leadership at a time when our community really needs it the most. And so we really have to get this right. And so we've taken this charge very seriously, not just to take grant resources, raise money, and to deploy them into the community in the most responsible way possible, but to really truly look at what we as an organization need to be doing to take care of ourselves so that we can then also share that with others. What issues are we facing? We know others are going to be facing those same issues. And to create a hub of information exchange for people so that as we're learning how we should be operating, we are learning with our nonprofit partners, with our funding and our partners in the philanthropic community. Because at that time, at the beginning of all this, nobody knew what was coming. And I dare say, we still don't know what's coming. And so I think one of the most important things that we did at the onset was to recognize that we needed to be a learning institution and to be in a place and to set up an infrastructure that would allow for that kind of dialogue. The other thing that we knew would need to happen is that business as usual was not going to be good enough, and we needed to start to think differently, and we needed to be much more entrepreneurial than I think we had ever been before, and we didn't even really know what that meant, but we know that we know that we need to be creative, thinking outside the box and doing things differently and thinking on the fly and very quickly. And so I share that with you because what transpired over the course of the next few days was just that. It was a period of looking around and saying, what do we need to do, but who do we need to be partnered with to make the biggest difference right now? And so the first thing we knew we needed to set up our community, our disaster response fund at the foundation. We had it in place from the Thomas Fire and Debris Flow, but we needed to relaunch that. What we learned during the Thomas Fire and Debris Flow was that we were certainly better off in full partnership with the United Way of Santa Barbara County. We were able to deploy resources to support individuals with financial assistance through the United Way, where we were not able to do that. We were then able to focus our expertise and what we had accumulated over decades of working with this community to meet the emerging and emergency needs of our community. And so we focused the Santa Barbara Foundation on those emerging needs, and United Way on the individual assistance. And so we immediately created that joint partnership. As we were defining this, and I'm laughing because, or smiling anyway, because it was really over the course of a 24-hour period, through the course of conversation, kind of parsing out the roles that we were going to play and how we could best bring in resources and activate them in the community, we realized too that in the last disasters, we learned that Hutton Parker Foundation and some of our other philanthropic colleagues had played an essential role in providing general operating support to some of the nonprofits at the same time as we were also trying to meet some critical needs. We knew that those operating dollars were going to be really important in this scenario as well. And so we reached out to Hutton Parker, who immediately joined in as the third leg of that stool, which then became a joint response effort. We had a meeting with the Foundation Roundtable within less than 24 hours after that conversation. And we really honestly were, you hear the saying, building the ship as you're sailing it. We were, and we had laid out to the Foundation Roundtable this vision of this partnership that would sort of meet as many needs in the community as we could by playing to the strengths of each of our individual organizations. And so we proposed the joint partnership to the Foundation Roundtable. And it was, I have to say, I was overwhelmed by the enthusiastic but incredibly generous response of those other philanthropic partners that we work with, just to say, we're in. And you know, I have to say, it was overwhelming because we didn't even know what that meant. And we said, you know, let's join in partnership. What does that mean exactly? And no one really, you know, got into the details. They just said, we want to help. We want to be there with you, for you. And we will do whatever it takes. And so, you know, over the course of those next couple of days, which would have been around March 12th, 13th, we then began to define what that means and how all of this is going to fit together. And, you know, again, I would just say it's still evolving. We are still defining that. We're still building the ship as we're sailing it. But there's a level of trust in our philanthropic community right now that is incredibly high. That I do think that, like all of us, donors and foundations are looking to see what is this going to look like 2 weeks from now, 4 weeks from now, you know, 2 months from now, 5 months from now, and how many resources are we going to need in the overall picture, and how quickly should we be deploying them, not knowing what in total they're actually going to be. And so there's a little bit of caution at the same time as there is a significant amount of concern and, of course, anxiety about making sure that critical needs are met, but then also that the nonprofits that we know are so essential to our community and that we love and that we count on to create the quality of life that we love and value so much here in Santa Barbara County, they need to stay afloat. And so that's, you know, weighing all of that, balancing all of that, I think is where we are right now. In terms of the amounts of money, we've publicized this, and I will say it's a ballpark number because these numbers are changing all the time. We have about 20 different organizations, foundations, small to large, that have signed on to the joint effort. And that means that they have either said that they will commit to either depositing money into the Community Disaster Relief Fund at the Santa Barbara Foundation to be deployed to nonprofits or to the United Way to support individuals with their financial assistance, or that they commit to just contributing to the overall effort through their own foundations. but at the very least, they're committed to being a part of actively knowing what's going on in the community, listening, understanding what the issues are, staying current, sharing information, and so that at the end of the day, we're all deploying our resources as efficiently and as effectively as possible. You know, we don't, and I'm not supportive actually of any hard and fast rules around this joint effort right now, because we need to, it is a lot more work, let me put it that way, to create this fluid partnership. But I think the more that people are able to participate the way that they want to, the way that they're comfortable, the way that their boards will allow them to, we're going to maximize the amount of resources that are ultimately deployed into the community. So that's sort of how the structure is set up. It's fluid, it's loose, but it's about information exchange. It's about learning from each other. It's about sharing information and contributing financially to the overall picture. The way right now, what we've done so far is we've raised about, in the fund at the Santa Barbara Foundation, about $1.6 million. And I should add that the $500,000 of that so far has been contributed through a corporate effort that was led by the Deckers Corporation. They have solicited their peers and asked them all to step up in this time of great need for Santa Barbara County. And so there's a fund that is set up specifically with those dollars, and that's part of our overall fund. There are some funds within that dollar amount that are restricted to certain issue areas, such as healthcare or providing childcare for essential employees like healthcare providers or first responders. There are other dollars that are restricted to certain areas of the county that are either geographic areas, such as in North County, or others. So we have honored all of our donors' wishes and started accepting applications to the fund a week ago Friday, and we just finished our first cycle. This cycle had, in just one cycle, 39 applications that totaled over $1,098,000. We have about 40 applications already in our second cycle, and our third cycle is open, and we're starting to accumulate those, and there are already about 10 applications in that cycle. I share those numbers with you because I want you to understand the enormity of this challenge. $1.6 million is wonderful, and we're so grateful for that. It is going to take millions and millions more to address the needs that we are seeing that, in these applications, and that's just what we're seeing right now. So what are we seeing? We have seen incredible bravery from our community. There are organizations that have ramped up their traditional program models, like the food bank, and I'm sure everyone's aware of the incredible resources they've been to our community. And we made an early grant to the food bank, as did most of the funders in the Funders Collaborative, to support their efforts. Ramping up, that is one whole body of work that many organizations are doing to meet those critical needs. The other is pivoting. Nonprofits right now are being called upon to look at the work that they're doing and look at it differently. And so we've got the Boys and Girls Club of Mid-Central Coast, and we've got the United Boys and Girls Club that are, they are no longer able to serve the youth in their facilities, and so they have pivoted and become part of the food delivery or supply delivery or distribution system. And so there are a whole group of nonprofits that have been very creative with their business model and gone through that pivoting process. And then there are others that are not going to be able to be a part of meeting these essential services. They are nonprofits who are just simply trying to survive right now. many of our arts institutions and our cultural institutions that are no longer able to accept their attendees and participants, paying customers, coming to shows or events. And so that lost revenue has really has created a challenge for them as well. And so those are some of the applications that we've seen. We are prioritizing those that are meeting the essential needs at the moment, but at the same time, and I have to give a shout out to Jordan Killebrew on the call today. He's done a fabulous job at helping create this resource hub on our website, where I'm sure like you get lots of emails every day. We do too, and we're trying to cull through that information as quickly as we can and sort it into what would be helpful for the nonprofit sector, and then what would be helpful for small businesses. We are looking at local, state, and regional and federal sources, and we try to get that information up on the website as quickly as possible. The other thing that we noticed is that a lot of people are incredibly wonderful. They're trying to help, and so they will call to say that they have spaces available to distribute medical supplies from, or they have sewing machines to make masks, or an organization will call and talk about, I know in North County, there was a child care services. They had 200 bars of soap, 200 bars of soap. They needed like thousands and thousands of bars of soap. And so we found ourselves in sort of this place like, well, we could be a hub for that information. And so we quickly researched and found a way to facilitate connecting those dots between people who had resources and people who need them. And so there's something on our website now called Ways to Help, and it's for organizations to automatically upload whether they need volunteers or they need supplies or they need financial assistance. They're able to upload those needs on the computer. And now our challenge, and I'm sharing this with you because I want you to be a part of this solution with us, is to get it out there to individuals who have the ability to meet those needs. And so please visit that on the website. It's Ways to Help. Resources. Well, before I leave that, I will say we are learning more every day, as I'm sure you are, and there's a call right after this that the Goleta Chamber of Commerce is putting on. And it's about the CARES Act and the loans that are currently available through the CARES Act, from the expanding existing loan programs to new programs that are out there. And without getting into the details of those, they are on our website as well. We're trying to get that information into people's hands, but then also we're hosting webinars, pointing people to other webinars and resources that they can access. This is an evolving process, and we're trying to make sure that that information gets to people as quickly as possible. Then the last thing I'll say about that is, well, actually, let me stop there and see if I can take a question or two. I don't see anything that's popping out of me as questions, but Jonathan?
Sure, thank you, Jackie. Thank you so much for that. We have well over 50 people on the call now, so just as a reminder, we're going to use the chat room for questions. So please enter any questions you might have in the chat box at the bottom. I'll take advantage of the microphone, Jackie. I know that one of the core focus areas for the foundation prior to this disaster is kind of everything about working families. You mentioned the collaboration amongst the different funders, and you mentioned that, which is great. Could you just share kind of what you see some of the major pressure points for working families in our community having to do with this crisis beyond obviously the healthcare issue?
Well, one of them, first of all, just basic needs. A lot of people facing unemployment at the moment are just struggling with basic needs. And while it is early efforts at the state level were taken to put a moratorium on evictions, that's great. And there are other programs now through the CARES Act to provide resources to families so that they can pay utilities and pay bills. That's great. A lot of loan deferrals, student loan deferrals, rent deferrals. There's a lot of that going on, but that need still exists. And so the applications that we're accepting through the United Way, what we're seeing, we took originally intake forms for the first couple of weeks just to get a sense, just to gauge the level of what's going on, who needs what. And we had, by last Friday, this is before we actually opened the applications, 950 intake forms with people requesting financial assistance for everything from rent to childcare. And so when I know the United Way has been working incredibly hard over the last 3 days, because the applications opened on Monday of this week. And I know yesterday they had processed over 500 applications. Just to put this in perspective for you, that is over, the 950 was double what we had seen in the Thomas Fire and debris flow, the individual applications that came in. And so we're expecting this to be significant. And again, we're going to be needing more resources to meet that need. One of the reasons why we delayed or deferred the application process is because we wanted to see what the CARES Act was going to bring, and who was going to be eligible for it and what those gaps were going to be. And so that's been helpful to know that right now, and then also to be able to provide those resources to the individuals who apply. We do, the United Way partners with the Family Services Agency, so FSA is doing all the casework for them, and they are actually contracting with some family resource centers throughout the county, because this is countywide. It's a much different geography than we were dealing with in the previous disasters. So they have deployed a lot of the nonprofit partners as resources with that casework. The other thing that we're seeing is this need for childcare for essential workers. This is one of the highest priorities for Cottage Hospital and for some of the healthcare institutions. And also first responders, those that need to be out there working and have a need, not just for childcare as they normally would, but now they have, with all the schools closed, even a need for childcare where kids would normally have been in school. And so it's been incredible to watch a couple of our partners in the Funders Collaborative, the Audacious Foundation and the Natalie Orfala Foundation, are leading an effort to coordinate child care resources for our entire county. And so they have brought together a steering committee under the United Way. They have stood up a fund where they will feed that fund with at least $500,000 going forward. And then they will be asking other people to contribute to that as well. But that is to address, to look at what resources are out there. The YMCA in Santa Maria Valley is pivoting to start to do more childcare. We have the Lompoc Valley School District that is working so hard to address their needs in childcare. So just getting a sense from around the county of who's doing what, where the gaps are, how are we going to create a safe environment for kids, but also one that is it's a healthy and a learning environment for kids while they're being cared for. What is the cost of that, and where are those gaps? And so they've taken that on, and I'm really excited about that initiative. I should add, there are several other initiatives that are like that, that are brewing around behavioral health, around seniors, around caregiving. I mean, this issue is affecting all parts of our life. I mean, from our community systems, our food systems, our social systems, our healthcare system, our economic system. And so it's, we sort of have to break that down into these sub areas where we're able to analyze each one of these things and get the right people to the table to be able to do that. So if anyone on this call has an interest in being a part of any of those sort of subgroups or collaborations, just let us know about that.
That's great. Jackie, there's a bunch of questions. I'm not sure if you can see it in the chat bar. You mentioned the child care connection with school out to the rest of the for the rest of the year. There seems like there's a wonderful marriage there of perhaps teenagers providing care for younger children. How are you addressing some of the issues such as testing, or how are some of the service providers dealing with issues of testing for people that are going to be service providers, that they're not potentially carrying the disease? Is that something the foundation is concerned about and involved with?
Is the question if we are testing the?
Well, no, I imagine that the Santa Barbara Foundation would be doing it, but the ultimate not-for-profits that are delivering their services, whether it's elder care or child care, are obviously in close proximity with at-risk population. Yeah. Just curious about how from a macro funding perspective, you're thinking about that issue.
Well, one thing I know almost every single organization that we've talked with have had to, that are providing services, have had to adapt how they're doing it. From homeless shelters, separating beds to create more distance, to people who are making and serving food, are all taking steps that are usually, according to the Public Health Department of CDC, they're following those guidelines. What we're seeing is, one, with the reduction in actual staff being able to do the work, and there's an increased need for volunteers. Many of the volunteer core that organizations have been used to have been people who are 65 and above, who are retired. And so there's just a real need to distribute the workforce and get it the right people and in front of the clients that they need to be serving with the right equipment and supplies. It's a huge issue, and in places like the homeless shelters are not able to, their capacity is diminished because now they have fewer just floor space available for people, which is exacerbating that issue. So it's an issue of PPE or the equipment that is needed and the guidelines that are to be followed. But the ripple effect of all of that is through all of those systems. The human resource system, the delivery system is huge. So we are looking at that sort of not just in one way. But Rubai, is that you that I hear?
Yes. I just wanted to add to that. Thank you, Jackie. Specifically to childcare, the coordination in childcare is happening from multiple angles. One is the childcare providers themselves, and also advocates and organizations that want to support their work. Licensing specifically has created new parameters under this order for the pandemic. Because the information is now centralized with funders and also with providers, a large number of providers, and there's countywide organizations that can disseminate what those parameters are for childcare providers. I think that's how I'm reading the question. And so there is a lot of communication on what is allowable in terms of testing, and public health is involved in this process, as is licensing. They've moved surprisingly fast in terms of licensing to be able to come up with provisions that organizations can work with. An example may be if you are two colleagues that work as healthcare providers within the same clinic, a nurse and a doctor, it is possible for children of those two colleagues with proper distancing can receive childcare on a shared facility. Now, that wouldn't apply for example, a city worker. I'm getting into the weeds at this point. But my point is that there actually is an incredible amount of coordination that's happening, and we're disseminating that information onto the county. When I say we, it is a communication bridge that's been built with funders and the providers themselves, and coordinating agencies like Source and Referral and First 5 Santa Barbara County.
Thank you, everybody. That's really helpful.
Jackie, maybe one question kind of on internal matters, and I'm going to throw a softball at you to wrap this up and try to be respectful of your time. One of the things that always comes up when it comes to charitable donations through community foundations, such as the Santa Barbara Foundation, is the portion of overhead that's charged. My understanding is that the foundation is really putting the dollars to work. Could you elaborate on that?
We waive the administrative fees, so all of the dollars that are contributed to the fund are going out to the community. So thanks for asking that. And that website is sbfoundation.org. Jonathan, I do have a little extra time, so if we need to go past just by 1:45, just so you know that.
Okay, no, much appreciated. Yeah. Thank you for that. Again, you can enter your questions in the chat bar. I was intrigued, Jackie, both you earlier talked about the level of trust among funders, and Rubai, for everybody's knowledge, who also is a senior exec at the foundation, was talking about the beneficial, the fast track, I guess, that the county was providing on some of the regulatory matters. Do you we're in the middle of a crisis, so of course everybody is trying to put out the fire. But I'm curious as to I know you're an optimist. I'm just curious as to your thoughts about going forward, whether there's some good that comes out of this crisis in terms of the ability for different sectors in our economy to work together, in terms of funders, in terms of service providers. Rahm Emanuel, former chief of staff to Bill Clinton, said a crisis is a terrible thing to waste.
Oh, I couldn't agree with that more. We saw several of you on this phone call, I can see, were the recipient of an email from a colleague who kind of said, here's what I know, long list, having culled through all of the information. And at the end of it said, there's a lot of information that's out there, but how do we as a community, whether we're in the nonprofit, the for-profit, sector, government, how do we make sure that nobody is missing from this equation, that everybody gets the information that they need? Where are the gaps? Where are the people that are not going to get this information? And so there are partnerships, there are collaborations, there are relationships that are being built that are going to last forever after this, because I really do think, from what I've seen, we are doing business, as I said at the beginning, differently, and with a great deal of respect for what each partner brings to the table, realizing that we don't have time to waste. So we're maximizing all the contributions from each of the partners. And that's creating and forming, a lot of new partnerships. I have a question here that is about what types of requests are you receiving in the application pool industries? So we are seeing requests from, and I think I touched on this a little bit before, so I won't spend too much more time on it, but from mostly food distribution organizations, counseling centers that are going to telehealth, domestic violence solutions is ramping up, unfortunately, much needed resources throughout the county. The colleges are doing things differently, just becoming a hub in the community for distribution of supplies. I thought we were going to see more of a need for technology for kids in classrooms. We had our staff do an analysis of that throughout the county, and what we found is the hardware's there, but the broadband is missing. So I want to raise that, because that's going to be something that we're going to be dealing with for a long time here. We have to get that broadband taken care of, access to the internet. From the businesses side of things, we are supporting Weave. They are providing loans to businesses throughout Santa Barbara County, and so we're making an investment in Weave, and we hope others will follow, because they are a great partner in our community to be able to bridge the time frame that it takes some people to get their small business administration loans, if they're even eligible at all. And so they do focus on some of those smaller organizations, and so we're directing our for-profit partners there. So I think that touches on that one. There's a question about testing and the antigens. I don't know a lot about this, but I have asked a lot about it. This is looking at who has had the virus, and I'm not an expert on this, I'm not going to pretend to be, but there's a way to identify people who have enough antibodies where they are not going to get the virus again. There are tests being tested at the moment all throughout the world, and Amgen in our region is actually doing a lot of work on that right now. And so the only thing I can tell you is that I don't have all the answers on that, but that is one thing that I do know in our region that is happening, is Amgen is testing that. I think those are all. I'm doing. The question is, how can we help? Thank you for that. So I think that the obvious answer is funding, and I'm not going to start there. But what I will say is that I think that building on the theme, I think that's come up through this today, is just being trusting that we are all going to get through this together. I do believe this community has the resources that it needs. We've got incredible people here who are not just compassionate and empathetic, but who are incredibly bright and resourceful and entrepreneurial, and they have done a great job coming together. And so I would love to see that everyone on this call and anyone else who we continue to work with through the Funders Collaborative and the Santa Barbara Foundation just continue to work together in that trusting partnership. So that's the first thing. And then that leads to sharing information and really being willing to share that information so that we can continue to be that vehicle to get information out and to help other organizations that we work with continue to enhance and expand the role that they play in the community. So that just partnership and sharing information is really important to us. And then finally, of course, our fund that's on our website is which is sbfoundation.org. That's always going to be helpful.
Well, Jackie, I'm not sure what question I could ask or anyone could ask after that last one. That kind of wraps it up.
So,
go ahead.
Jonathan, there is one more question. So the question is about the foundation being a convening role, organizing Zoom. And I should say, we do on the website have webinars that we've already hosted for the nonprofit sector. One of the things that we heard early on, this was at the very beginning, was that the nonprofits were going to deal with all the furloughs and the layoffs, and our, all of us have been looking at that issue and what does that mean from a legal and an HR perspective. And so we hired a lawyer that we have worked with to conduct a webinar on HR and legal issues for nonprofits. And so that happened about, I guess, a week and a half or 2 weeks ago. That was followed by another one that we partnered with VOAD on. And that was to look at business continuity issues that we knew nonprofits were going to start to face. And then we are looking at another one about business strategy at the moment. And we are, that is all being led by our new Director of a Collaboration for Social Impact, Gary Clark, who came from the Fund for Santa Barbara, who started his first day on the job on, I think it was March 2nd, whatever that Monday was, right when all of this started. So yeah, he's been in high speed on all cylinders, but he is also working with our partners at NPRN and the fund and others who are also looking at pushing resources out to organizations so that we're not duplicating, overwhelming, overlapping. That's all being coordinated through a nonprofit capacity building group. So I hope that helps.
Absolutely. Thank you for that answer. Thank you, Seth, for bringing it up. I guess then, to be respectful of everyone's time, I want to thank you so much for being a wonderful speaker on this this first SCA Conversations program. You mentioned the convening role. SCA is definitely also playing a convening role, and we have a number of Zoom calls coming up. We're going to do them every Wednesday for the foreseeable future at the same time, starting at 1 o'clock. Next Wednesday, April 8th at 1, we'll have Amy Cooper and Jeff Green of the Chamber of Commerce talking about the impact on our local small business community. On the 15th, we're going to hear from Kaya Jordan about values in the time of Corona. And then on the 22nd, you already mentioned but we have Kathy Odell, who is the CEO of Women's Economic Ventures on business and community resiliency. You can learn all about those events on sustainablechangealliance.org. Thanks again to Jackie, to Jordan, and to Rubaya of the foundation. Thank you to the SCA community, our members, our supporters, our sponsors, and in particular, thanks to everybody who's on the front line, whether it's a medical professional or dealing directly with the economic challenge that we're all facing. Thank you for everything you do. Stay well.
Thank you, Jonathan.